Hi everyone, it's Jasmine. Welcome back to my channel. Today, I want to share a fascinating case from my teacher's clinical practice. A patient who coughed every time she spoke. This is a classic example of how understanding the root cause in traditional Chinese medicine, TCM, can lead to a simple and effective treatment. And it's a case my teacher often uses to teach us the importance of accurate diagnosis. A 37-year-old female patient came to my teacher with a 1-month history of cough. The defining feature of her cough was that it was triggered only when she spoke. Even during their consultation, every time she tried to answer my teacher's questions, she would immediately start coughing. When my teacher asked about her occupation, she told him she was a teacher. My teacher explains that this type of cough is extremely common in professions that require a lot of speaking, such as teachers, especially head teachers, tour guides, and live streaming influencers. In general, it's seen in people who use their voices excessively. For these patients, my teacher always advises them to rest their voice and minimize speaking to conserve their energy. On examination, her tongue was pale with a thin white coating and tooth marks on the edges, a sign of qi deficiency, and her pulse was weak. These are the key signs my teacher taught us to look for in such cases. In TCM, my teacher diagnoses this type of cough as qi deficiency. He teaches us that when a person's qi is weak, their ability to hold the breath and maintain the voice is compromised, leading to coughing when speaking. The treatment principle is clear. We need to tonify qi. For this condition, my teacher says there are several effective formulas. If we follow the classic formulas, we could use Huang Qi Gui Zi Wu, Wu-Tang astragalus, and cinnamon twig 5 ingredients decoction. However, in his clinical experience, he's found Bu Zhang Yi Qi Temps Central Qi Boosting Decoction to be particularly effective for this specific presentation. So that's what he prescribed. The prescription my teacher used was Huang Qi astragalus 30 grams, Zigan cow honey fried licorice 6 grams, Runshen ginseng 6克, Baiju atractylodes 9 grams, Dangui angelica sinensis 3克, Chenpai tangerine peel 2克, Shangma black cohosh 3 grams, Chaihu buplorum 3 grams. My teacher reports that she took this decoction for 7 days. After just 2 days, her cough had completely stopped, and she could speak without triggering it. After the initial 7 days, he switched her to the patent medicine, Bu Zhang Yi Qi 1 Central Qi Boosting Pill for maintenance, and advised her to continue reducing her speaking time to preserve her body's energy. The most important lesson my teacher wants us to learn from this case is that the root of the problem was qi deficiency. Once we identify that, he says, the treatment becomes straightforward. By tonifying the qi, we can resolve the cough completely. I hope this case, shared through my teacher's wisdom, was insightful for you. If you're interested in more TCM case studies from my learning journey, please like, subscribe, and hit the notification bell. Let me know in the comments if you've ever experienced something similar, or if you have any questions about qi deficiency. Until next time, take care.